So, two new trials published this year that caught my attention on the use of vitamin D in breast cancer. And the question is, does it improve long term outcomes? So, these were two randomized trials, one from Turkey, one from Brazil. And they were, in the trial from Turkey, they were supplementing with vitamin D 50,000 international units per week, and this was used throughout chemotherapy. And in the trial from Brazil, they were using 2,000 international units per day throughout chemotherapy. And what was kind of more unique about this trial is that there's a group of patients that are given chemotherapy first to try to shrink down a breast cancer mass and area to get cleaner margins before surgery. And there's a goal or a marker that's important called PCR, pathological complete response. And what that implies is that it's a signal that if there's a complete destruction or killing of the cancer cells as a result of chemotherapy, it could imply longer term and potentially improved survival down the road. So it's an interesting marker. So, anyways, in these two trials that were apparently independent of each other, they're using different doses, different countries. They kind of noticed that a higher vitamin D, supplementing with the vitamin D, led to more PCRs in their population groups. And then the Turkish study, they looked at more longer term outcomes, and there was a trend of potentially more improved survival. So, anyways, this is something of interest. And then in the Brazilian study, they even were looking at, hey, patients that had much lower levels of vitamin D, those groups didn't lead to PCR as often as the groups that had higher levels of vitamin D in the blood. So, implying, should we be testing patients with vitamin D as soon as they're starting neoadjuvant chemotherapy, or when they're given chemotherapy first to shrink down the breast cancer mass? So it's an interesting questions. Again, these are two trials that were published that were randomized, two different countries, two different doses, but again, pointing to this whole picture of such a simple, low cost, low risk vitamin. Should we be providing vitamin D and in patients with breast cancer that could potentially lead to better responses to chemotherapy and potentially longer term outcomes?